I'm Video Ramphal. Thank you very much for joining us. The Prime Minister of Trinidad and Tobago, Dr. Keith Rowley, is hosting a media conference at the Diplomatic Center in Port of Spain. We are bringing you live coverage on TDT, Talk City 91.1 FM, Suite 100.1 FM, Next 99.1, and on Facebook at TDT Live Online. Let's take you over now to the Diplomatic Center in Port of Spain.
Good afternoon, ladies and gentlemen, members of the media in particular, those of you who are here with us at the Diplomatic Center, members of the viewing and listening public, wherever you might be, welcome to the daily contact with the population of Trinidad and Tobago. Today we'll have a slightly modified version of the normal format. I will say a few words first, then I will ask CMO to give us a more detailed daily briefing, and then I'll come back to you, say a few more words, and then we'll open the floor to the question session. When I spoke to you last, at an earlier time, I did tell you that sometime before the 30th of April, we would be in a position, having seen how our progress would have been, that we would come just before, sometime before the 30th, and tell you what the immediate future holds for us with respect to decision making, and give you a report as to how we have fared. Well, today is that day. We've had considerable analysis of our position, and we now can report to you on that, and we will then indicate the way forward as we conclude the day. I just want to say, ladies and gentlemen, that we started out on a fairly long journey. We are still on that journey, and there's still a long way to go. However, we can report that our travels have not been as painful as it could have been, because when one looks at the trajectory of our experience as compared to what might have been, what could have been, and what other persons have had, Trinidad and Tobago today is in a fairly good place, because we have taken certain steps that have paid us some dividends with respect to controlling the negative output that could have come to us. Our parallel health system is working, has worked, and gives us the comfort that if things change dramatically, we would be in a position to respond. You will get some more detail on that from the Minister and the CMO. And of course, unfortunately, we have lost a few people. 4 lives we've lost, attributed to, 8 lives we've lost, attributed to the virus. And we continue to empathize with those members of the families and communities that have lost people in this way. And also, all along, our frontliners, our health staff, those people who have been out interacting with, finding, treating, caring for, protecting the people of Trinidad and Tobago, we continue to be eternally grateful to them for the good job that they have done and that they are doing. And fortunately, we have not had any bad reports from their interactions with persons who have actually been affected by the virus. So on a number of fronts, we have some good news. We have discovered, and I'm sure that a large number of our population is discovering, that we did have in the pool of public servants in particular, persons who have been trained in specialist areas, trained to a level that has been to international standard, and who have been able to come forward and perform to the highest level of professionalism in this area of public health. We are now seeing the benefits of that, and it is all of that that has put us in a position to be able to report today, 3 months after we have been battling with this challenge, that we are in a position that is not hopeless. It is still an emergency situation, but we've evaded the health crisis in the physical sense of having patients descending on the hospitals. If you look at the television in other countries, you will see what that means. But here in Trinidad and Tobago, our experience has been a bit better. At the level of the government, what we have done from the very beginning, largely because of our Caribbean experience, we have placed our confidence in our scientifically trained personnel. They've spoken to us directly and openly. They have been allowed to speak without fear, and we have listened to them, we have appreciated them, and we have respected them and their advice. And the actions of the government of Trinidad and Tobago have been guided by the information provided to us by our technical people, and our national decisions have been made based on the science. So today, I want to indicate that what we did, there were 6 things that we did, just to allow you to appreciate what we have to continue to do. Well, first and foremost, we gave ourselves to the science and the professionalism. We closed our border early to persons from the source of the virus. We shut out some countries, but we closed our border to certain people very early, and then we ended up closing our border and closing it to nationals at one stage. At that final stage, we closed our border even to some nationals who are outside. I did indicate to you that we have 330,000 people outside of Trinidad and Tobago who are carrying Trinidad and Tobago's passports. Not that they live in Trinidad and Tobago, but they do carry our passport, and I recognize as Trinidad and Tobago citizens. Most of those persons live abroad, and they have a connection to Trinidad and Tobago. But in this scenario, what we have done is to focus on preserving the health and the lives of the 1.4 million people in the territory of Trinidad and Tobago at the time when we had to make the decisions based on the threat of the virus and the advice of our public health experts. So we closed our border. We also did very early, we closed our schools. When I first mentioned the closing of schools, I remember I told you we closed it for 1 week in the first instance. That was very early, and we've kept our schools closed until now. And the health experts will tell you that one of the reasons that we were able to do that very early is because we were aware of the kinds of infection that can happen among the school population and the people who interact with our children. Children home and children at school are 2 different population reactions. So we very early closed our schools to deny the virus the access, that easy access from person to person. Because one of the things that had to be done, and which is probably the most effective response to the virus, was the physical distancing that was required in all populations in the world. Keep away from the person next to you. And managing tens of thousands of children, that would have been very difficult, that particular instruction. So the next best one was to close the schools and separate the children as much as we could. And I think that has helped us in a way. And of course, as we went closer, as we began to get persons coming to the hospitals, realizing that we did have some level of infection, we also had some information, clear information of persons importing the virus into our community. We embarked upon the stay at home. I know that that is very, very stressful for persons who never had this experience before, and all our lives have been on a certain pattern. You wake up, you get up, you go out, you come back, you interact, and so on. And then to be told, no, we find ourselves being confined, not to punish anybody, but that is the response that we had to make and we must make to prevent the virus from spreading from one person to another, because that is the nature of the problem, an infection spreading from one person to another. But if you could prevent that bridge from person to person, that is how you can deal with it, because we have no therapeutic arrangements that could allow us to roll back an infection, and we have no vaccine to allow us to develop an immunity. It's called a novel coronavirus because it's just something new that we're dealing with. This particular virus is new. Its cousins have been around for quite a while, but our immunity to those seasonal viruses not helping us here. We are exposed to this novel coronavirus. So physical distancing, stay at home, and of course, the very simple but most effective emphasis on hygiene. Washing your hands, washing hands as often. It sounds very simple, but the virus can only get into the body if we put it into our own bodies, or if someone speaks straight into one of your orifices, like your mouth, your nose, and the eyes, so on. So we've been told, wash your hands, keep your hands away from your face, and of course, the other protocols that we've been working for the last 12 weeks. So those 5 things we have done, and the no congregation, right? If you go out, don't congregate, and where there are congregations, we've forbidden them. Bars, games in the stadium, workplaces with crowds and so on, we had to stop the work because the congregating of people, once again, you congregate, you provide bridges from one person to the other, and the virus will defeat us. So we did those 6 things. I understand also that to many persons, the effect of doing this is one that brings a lot of pain, either financial, even mental, and there are voices calling on us to respond to that. Some persons are saying we should open back the economy. Some persons are saying we should allow persons to come out and be themselves. Just remember that the only reason why we today could speak about being in a position that is not calamitous is because we have done the things that have made it stressful for us. If we did not do those things, and if we are not doing those things, we will have a different story. I have no doubt that the resistance to doing these simple things would not be there if our experience had been one of multiple coffins heading to the mortuary or the cemetery on a regular basis. There would have been a different reaction. But that is not what we try to avoid. And we have avoided that so far. But let us not take that as a license to behave as though the threat no longer exists. The threat is alive and well. And as we speak about opening up, let us have the opening up done on the same basis as the management that we've done to date, which is be guided by the scientists, be guided by the data, be guided by the advice to the government from our public health expert. Or experts, I should say, because it's not a one-man show, it's a department. As you would have gathered by now, it's a fairly large department because the minister has been able to trot out a number of, I'm not at a pun there, starting with Dr. Trotman. The minister has been able to present to the country a number of very senior and experienced officers from the Department of Public Health, most of whom, if not all of them, unknown to the national community, but thankfully who were there and who were able to step into the breach when this situation developed as an international concern in the form of a pandemic. So I would stop here and ask CMO to give us our daily briefing and the analysis of our go to the podium, yeah? An analysis, turn the mic on, please. Yeah. So CMO Parasham would give us our briefing and would give us an analysis of our situation at this point in time, and then I'll come back after that and continue the conversation.
Okay, thank you, Honorable Prime Minister, Honorable Minister of Health. members of the media, members of the viewing and listening public. So as of today, April 25th, 2020, our morning update would have indicated the number of samples submitted to CAFA thus far, 1,501. Number of tests completed, 1,235. Number of repeated samples, 266. Number of samples which would have tested positive, 115. Number of deaths, 8. Number of discharges would now stand at 52. Yesterday we were at 48. There were 4 additional discharges between yesterday and today, 3 from the Sandy Grande facility and 1 from the Home of Football. Taking the number of hospitalized patients remains at 10. There are 10 persons in the Couva facility. There are no persons in the Cora facility. We were able to decant all those persons to the Home of Football a couple of days ago. In terms of, there's no patients within the ICU or high dependency unit at the Couva facility. All the patients are stable and well. In terms of our step-down facility, Sandy Grande remains at 8 because they have decanted 3 overnight, and the Home of Football, there are 37 persons there. If Prime Minister would allow, I have members of my team here as well. And in terms of the update going forward, what I would like maybe Dr. Hines briefly to give us an overview of the epidemiology of the outbreak thus far, beginning with Trinidad was listed by WHO as a sporadic sort of spread, and I discussed it a little while ago, meaning that we can have no spread, we can be listed as sporadic, meaning a few local cases in between together with majority imported cases. We can be listed as cluster, or we can be listed as community transmission. So I'll ask Dr. Hines to begin, and then Dr. Trotman just to go into a little more detail as to what she has seen and her team has seen with regards to Couva and Cora in terms of their management and experience with the patients in those facilities, how our staff have been responding, and how their protocols have been rolled out. So Dr. Hines?
Thank you, Dr. Parasram, Honorable Prime Minister, Honorable Ministers, members of the media, members of the viewing public, good afternoon. As CMO has said, the current epidemiologic situation, the history that we have had so far, is a history of a number of imported cases or travel-related cases. We have had sporadic importations, which we have detected. We have contained to a large extent. We have found all the persons that tested positive and their contacts. We've traced, we have monitored, and at this point in time, the population situation from an epidemiologic point of view is that we've had sporadic cases, and that those that occurred within country were within family, so minimal and few cases of what would have been deemed local transmission as opposed to community spread, which is a different situation altogether. So we've heard those terms used, we've heard local transmission used, and we've heard sporadic cases used, and that's the context in which they would have been used. The surveillance that we have been doing with the surveillance system has also looked at the numbers of persons presenting with respiratory illness to the health facilities, the persons who would have been admitted to the general hospital system with respiratory illness, and there was testing going on in those cases as well, which have not revealed any additional cases of the new coronavirus. So at this point, we have still managed so far to maintain that sporadic case classification, and we are expanding the surveillance, as has been mentioned before, to verify and to validate that we do not have any additional spread, any additional cases that we have not yet detected. So as we expand capacity to do that, there will be more testing and more information that we will analyze to get further perspective on what's happening. That's the update epidemiologically at this point in time.
Honorable Prime Minister, Minister of Health, Parasram, members of the media, good afternoon. The Couva and Cora experience has been able to support, to date, 115 patients. We grade patients based on their severity of illness, and so in each of these facilities, we are able to accommodate patients of different severity levels. For the most part, Cora takes care of people with mild illness and cover those with mild illness in addition to those with moderate and severe illnesses. We have been able to work through many challenges. I must say that the staff has been extremely accommodating. We have been able to broaden our services to from more basic services to encompass now support that is psychiatric, apart from psychiatric, now even looking into palliative type services, and we'll hear more about that. In addition, with the support of the homes for us to decant into, we are able to now separate those patients who no longer need hospital care out of the acute setting. And we feel fairly comfortable that we will be able to continue with that type of response to support what is needed in Trinidad and Tobago with the help of the systems that we presently have in place. Physical distancing, restriction of movement, wearing masks where appropriate. Thank you.
Ladies and gentlemen, what in effect is being said to you is that we have done well so far. The question now is, how much further can we go in preserving and hopefully improving our chances of evading calamity? To end up in a situation where we would have got away from the worst, if not get the best of a bad situation, we cannot now relax and do what would get us into trouble. Based on the way we've approached this and the requirements of the Public Health Department, we are required to give the technical people a further 14 days to conduct examinations of the population outside of the hospitalization situations, because so far what we did is to allow people to come from wherever they were, be identified by their ailment or by their movement, and we would have tested those persons who were symptomatic. Because the nature of this business, if people are not symptomatic and you test them for the sake of testing them to report that a test has been done, scientifically you're wasting time and wasting a scarce resource, which is a test kit. What we have been doing in Trinidad and Tobago, our protocol was that we would test you if you are symptomatic, and if there's confirmation of your condition, then you are quarantined. And of course, if you are not confirmed as having the virus, you deemed to be part of the larger population who may be asymptomatic or not carrying it at all. And now that we have this position where we have not been seeing increased presentations to doctors around the country, we have not been seeing people coming in any increased numbers with ailments to the medical facilities and to the district doctors. But we do know that in our population out there, there is some element of the virus being present. So what the scientists are required to do now is to go in, and Dr. Parasam described this at length once or twice before, and could again describe it again today, what you'll be doing with respect to the testing, the nature of the testing and the increased testing, to determine scientifically what presence or level of presence of the virus exists in the general population. That then will allow us to make confident opening up decisions. So in short, we need a few more days of holding the fort to be able to come to a point where we can open back up the situation, knowing in stronger and more acceptable data that our condition is A, B, C, or D. That, as of Monday, again, I think I would ask Dr. again to tell you how we'll proceed from Monday with respect to testing.
So in terms of the testing, as we said before, our testing capacity in Trinidad should be up and running by Monday, the 27th, which means that we just had a visit to the lab today as well, just to confirm that everything is in order. So far, everything is fine with the way the setup is being handled. The training has been done. All the equipment is on site. Testing kits are on site. They confirmed that they may be able to do about upwards of 50 tests per day, but we are looking at the lower limit to start, which if we go 14 days from the 27th, within the next 14 days after, we should be able to complete around 700 tests, which will give us a very good idea. If we are able to get all 700 in and they remain negative, it will be a very good sign that there's little or no community spread. We don't have that data at this point. What we had and we have started 2 weeks ago is random sampling at 8 health centers in Trinidad, 1 health center in Tobago, which we have received the results from, and they are all negative up to this point. So we're looking at upwards of 60, 70 tests so far, but I think we need to have a greater level of testing occurring randomly in a group of persons that we call acute viral illness, basically people who are outside the definition that we have been using for COVID-19. So understandably, COVID-19 tests were being done by the Caribbean Public Health Agency alone. For us and a lot of the Caribbean entities, their definitions have been guided by WHO as well as some internal guidance. They have rejected some of our samples that would have gone outside of the definition. Now that Trinidad is establishing its own unit, we can create our own definitions of what and who we want to test. So therefore, the Ministry of Health has some level of control over the policies in terms of rejections of tests. We will be able to widen our net much more easily in terms of sampling. We may even be able to sample other sorts of illnesses, for instance, severe acute respiratory illnesses, something that may be on the fringes where we have no other definition to define it from in terms of illnesses. We can sample those persons. We may be able to sample even persons that have asymptomatic disease from time to time if we think they are very high-risk groups, as we have seen for cases like the Balandra group in the past. So our testing will be widened. As I said, 50 tests a day we should be able to complete. We may be able to scale it up after about a week or so once we get the systems working well. But it will give us enough data at that point to tell us if we continue along the same vein, we continue to have our negatives. We have had over the last 10 days or so only 2 positive cases from the other surveillance system, which is through CAFA. If we continue having our negatives, we will be more confident to say that the community spread is extremely limited at that point in time.
So, that being the case, it is clear to us at the level of the government, what we need to do is to give this period so that we could do what is required to be done, which is to test that population of persons to get the comfort of an investigation of the wider population, not just rely on those who have presented with symptoms and ailments. It might sound to some people that, well, we think we know enough, that the thing to do is to make the change that we anxiously want to make. And that change is that we can go back to being as open as we used to be before. But understand that the nature of the problem, if we go back to our normal situation too early, it is very easy to have a resurgence. And we're not inventing any wheel here. You would have seen countries that thought that they were in a position to go back to some normalcy, and you saw what would have happened. I don't have to give you the international news. But the bottom line is that we are aiming to score a whole point as against half a point. Because so far, so good, we have done well enough. And if, as we expect, and I should say as we are hoping, that the rate at which new additions come to the confirmation column, meaning if we see the kinds of numbers we have been seeing for the last 3 weeks or so, if that is what we are going to see going forward to the 15th of May, at that time, by the 10th of May, we would be able to say to the country very confidently that we can begin to come out of this shell that we put ourselves into. And that is the horizon that we're working towards. Another 10 days of ramped up testing of a different cohort of the population. Because, you know, we can't force anybody to be tested, to say, okay, in random sampling, I want to test you, I want to test you, I want to test you. We can't do that. And if we're waiting for people to feel sick to come, and there's no one coming, then we have nobody to test. So what we're doing is testing anything that remotely looks like an expression of a flu, a viral, and though that gives us the randomness among persons who appear not to be well. And that is where the science is going to put us into a position to say, we think we are confident that our population in Trinidad and Tobago has this level of risk with respect to propagation of the virus in our population. That being so, and particularly in this period, it follows that one of the things that we have to do is to keep our border closed. Because our experience has been, most of what we have experienced with this virus coming into our population, the vast majority came from persons who came into us from the outside. So if we are doing what I just said that we are going to be doing in the next 10 days, it is imperative that we do not pollute that sampling of our population and the establishment of new contacts and the infection of new population cohorts by persons coming into Trinidad and Tobago. So unfortunately, we have to keep our border closed. There are serious consequences to that, but the greater consequence is to reinfect us and go back to square one where we were at 2 months ago. If we hold the course, we are likely, I can't promise you anything because I am not seeing anything, I am not influencing it. I'm simply saying if the outcome continues on the same trajectory of the curve that we are on now, by that date that I've just given you, which is the 15th of May, Trinidad and Tobago should be in a good position to begin or to reopen a lot of what we have shut down. So for the first time, I can tell you, this tunnel is not an endless journey now. We have a milepost on this journey, meaning that a little bit of light is appearing at the far end of the tunnel. So by the 10th of May, we should be in a position, if things go well, to be able to say to you that we can now relax a lot of what we have now constricted. But to get a good result by the 10th of May requires that we do what we have been doing and do it even better, which is to continue to stay at home, continue with the hygiene, and continue with the physical distancing, because those things have worked for us. Close borders, stay at home, good hygiene, and of course, we keep our physical distance. There are some things that are going on in the country which require people to be moving around. As you move around, we keep the protocol of the physical distancing. We do not congregate. And if you have to come out, as you have to, because one of the things we understand very clearly, especially from persons who have limited accommodation and limited financial resource and limited or no reserves in their food cupboard, that you have to come out. We understand that. And we want to say to you, we don't want to punish anybody. We want you to be alive. We want you, even if you have some serious inconvenience, first and foremost, we want at the end of this process, because it's going to end sometime, at the end of this process, we want you to be alive. Last night, I didn't see the result of the poll, but the poll at TV6 was asking after an interviewing of people in the streets who came out to look after themselves. The question was, if you have to choose between your livelihood and your health, meaning your life, what would you choose? I didn't see the result, but I suspect I know the answer to that. I think I know the answer. While you're healthy, you might say livelihood. But if you really in the hospital undergoing the rigors of this infection, I know you will say life. So, in short, we will keep the borders closed until at least the 15th of May. We will continue to stay at home until at least the 10th of May, because if by the 10th of May we would have seen enough of a downward movement of the curve, we could make that call before the 15th of May. We have established the 10th of May as the time by which we would have seen enough of the sampling of the deeper population. So that is our horizon for the moment. And against that background, today on the basis of the analysis that we've done with our health experts, we believe that we could take a little more risk, because it's all about risk. All of this closing and opening is all about how much risk you are prepared to take. Some people are prepared to take a lot more risk and pay a much higher price for other reasons. From day one, I told you here in Trinidad and Tobago, the level of risk that I'm prepared to take for the people of Trinidad and Tobago has to be governed by an ability to save lives. So we are going to, the Attorney General today will amend the regulation again to allow hardware stores to open for 6 days, every day except Sunday. And the reason for that is that when we contracted the period, because we were concerned about the congregation of persons going to hardwares, we discovered that by reducing the number of days, we didn't reduce the number of persons who were going there. More persons were going, and we decided, the thing to do is to allow a bit longer, so that the reason for that is that we don't want the congregation. So we said to you, we will make the adjustments as we have to along the way, and this is another one we're making. Right? So they'll be open for half day, but every day, except half day, every day, except Sundays. And of course, we will continue to keep our children home. I've heard about persons making plans to bring children out. I simply want to say to such persons, I know of no country to date, and I could be corrected, I stand corrected, I know of no country which has declared itself free from the clutches of the threats of this virus. Even the ones that have done best, countries like Iceland and Taiwan and Denmark, which very early in the game, did what had to be done in the way that we have done it. Even those countries are still keeping an eye on the virus, and particularly on those persons who are suffering resurgences now. And where the school population has been put back out, as in Denmark, I ask you to look at how they have done it and ask yourself if we are in a position in Trinidad and Tobago to do it like that. Because basically, they have re-engineered the physical space of all the schools and have a larger resource base, smaller class sizes, many more teachers, and public transportation, which is different. So each country has to make these decisions based on the nature of the country's infrastructure and its culture. Otherwise, the virus will win. And in the best of situations, nobody has rushed back out there and said, okay, we can blow a whistle now, match is over, virus gone. No country has reached that stage as yet. So please don't ask Trinidad and Tobago to try to be the first in that. We are still under heavy threat and constraints in dealing with this virus. The fact that we have not been able to report huge numbers of deaths should not be taken as a pass. It should be taken as a result of the things that we have been doing. So we cannot now say we don't know what to do and what will work for us for a little longer. Today we are in a position to give you an idea of the time frame against which our stressful stay at home. I remember when we were in the parliament once, one of my colleagues was put out of the parliament, and on the way out, he was grumbling, and one of our opponents in the parliament said to him, you want to go home all the time. They send you home now, you're quarreling. This is a country where people like to stay home from work. What happened? Oh, all of a sudden, I'll have a problem. This time, this problem, you're being invited to stay home. You're being paid to save your life. Let's do it for another 2 weeks. And hopefully, at the end of that 2-week period, we would be able to say that we have got sufficient control over the propagation of this virus in our population that we could do certain things that we would not have dared done before. And that is basically all that we can say at this time if we are aiming to score that whole point as against scoring half a point. Because this thing, one person coming in here, one person coming in here, not being quarantined, going into a community and starting community spread, because you heard about sporadic, you heard about, what's the other one? Cluster. We have sporadic because they came in one by one. First one came from Switzerland, another one came from Germany, and some came from elsewhere. Sporadically, they came in. We have 330,000 people out there, where many of them are not as good as it is here. So it is reasonable to expect that some of those persons are just waiting for the borders to open to come home. You would have seen in the United States, there are 22 million people who have lost their jobs in the last few weeks. Our population in the Caribbean makes up a part of that 22 million. And of course, in that system, your health care, if you have any at all, is linked to your job. Once you lose your job, lose health care. Just picture 330,000 people. If 1% of those people head for home, how many is that? That's 3,000. The day those 3,000 land here, all the preparations we've made would now be deficient. Because we have how many rooms?
3,000.
How many rooms?
900 and...
We have approximately 1,000 rooms in our virus preparation. If 1% of those on the outside who are catered for elsewhere decide to come home, on that day, the preparations will be deemed to be deficient. So what we had to do is to make sure that we keep those within our borders safe and, God willing, healthy, while we tell the others on the outside, shelter in place, protect yourself. And for example, our children in the universities, we've said to them after the initial intention was to bring them home, and for some reason, or for many reasons, we could not get a consensus and an arrangement to bring them home. So we decided that what we'll do is to provide them with sustenance where they are. So the Minister of Finance has taken steps that he did indicate that by Monday, we should begin to send some financial help to our students on campuses where the government of Trinidad and Tobago has liabilities and responsibilities. The University of the West Indies is a government institution, and therefore we use that as the yardstick by which we will identify and provide support for our students there. We will send some help to them to make sure they have shelter, they have food, and they're cared for by the territories in which they are, shelter in place. And of course, much as we'd like to, there are some other people who are close by, my understanding is that the people in Suriname, it is whether they are trying to arrange their transport. The Minister of National Security have given them the assurance that once they could get themselves here, they can come in. The ones from Barbados are now home in the country, going through the local quarantine. And of course, I have no doubt that there will be lots and lots of requests to the Minister of National Security for persons to come in. We just want to understand, much as we like to have everybody come home, there's a virus to be kept out and there are protocols to be followed. I want that to be very clear. We are not going to compromise the people of Trinidad and Tobago to please any interests other than the interests of the people of Trinidad and Tobago. Individual interests are individual interests, but the national interest is paramount. These are not decisions that are easy to make, but they have been made throughout history in order to serve the greater good. If you have any questions, we will take them now, and we have the other two doctors here, so Dr. Parasam will direct them to Dr. Hines and Dr. Trotman, if it happens to be like that, because he wants to give it to you from the horse's mouth. If there are matters from the minister, from the ministry, the minister will take them, and if there are matters from the government. But before I start the question, let me just say something. When I addressed you from this podium the very first time, I told you that there would be some serious consequences that will flow from the actions that we will have to take. By now you would have seen that. I also told the population that this assignment is one that will bring pain, it will bring inconvenience, but because we are all in this together, we have to share this burden. The virus is no respecter of race, class, creed, religion, or geographic location. We're sharing this burden. And that is why today I want to appeal to all persons, particularly landlords who have tenants, especially tenants from the lower income level in the national earning pyramid. I want to appeal to landlords that your share of the burden is to have a heart. You would have seen the government taking steps to protect you and your family and your community. And in so doing, those actions of the government would have deprived persons of their jobs, persons who were living from paycheck to paycheck, basically, as we say, hand to mouth. By the actions to protect all of us, they would have lost their ability to sustain themselves and their families. Have a heart. If they were your tenant before the virus, then for God's sake, see them as somebody who was working for you to pay your rent. And you would do yourself no benefit in the long run if you take the position that if they can't pay you now, that you'll put them in the street. I'm asking landlords, especially those landlords who are landlords to tenants of persons who have lost their job or have got their income reduced, that for this period, it's not going to be forever. We're working against a horizon of, say, 3 months to 5 months, we don't know. But for this period, if you are required to accept a reduced rent for the period, then that is your contribution in this fight. If there's no rent, I'm sure, landlord, that you are in a better position than the family that will go on the street with no place to sleep and no food. That should be your contribution. The government has intervened using the resources of all of us, the National Treasury, to try to get help to persons who are in that situation. It's a slow process, and what makes the process slow is because we just can't hand out checks to anybody who come and say, I want a check. You have to make sure that there are persons who qualify to accept to get that kind of support, because we don't have a bottomless pit of money. We have a certain limited amount of money, and we want to make sure that the money is going to the needy at the people who need it, and that's why there have to be some scrutiny, and we are trying to be as how should I put it? We're trying to be as free as we are with the distribution of these funds, but because of the nature of human beings, it is not the easiest of tasks. Sometimes it is the strongest lamb that gets to the nipple first. And if there are 3 lambs, lamb number 3, the weakest, has to drink after number 2 drinks, and by that time number 3 is hungry to death. So let us understand that there are people who are in greater need than we are in. And we need to have the milk of human kindness. It would be a great disappointment to us as a people to realize that in this situation, that some people are without some consideration for the dire circumstances of others who, through no fault of their own, are not in a position to discharge their liabilities to you. Have a heart. Questions, please?
Thank you, Prime Minister. My question is for the Chief Medical Officer. Good afternoon. Dr. Parasuram, you would have touched on this earlier, but can you offer some more details? From now till May 10th, what benchmark will you be using to guide decisions about possible opening up? So is it the number of confirmed cases per day? What's the formula you're looking at? Is there a particular number? And I guess I could also ask one time going forward, what's the benchmark for decision to say we may need to tighten it back up or keep it as is?
As you would have seen, we're not using the parallel system of testing alone. So we're looking at the number of cases that we get on the routine testing through CARFA. So CARFA is testing cases that would be highly suspect. So their definitions are aligned to highly suspect cases. As we have noted over the last week or just over a week, we only had 2 cases. So we are theoretically on the downwards or spiral as it relates to highly suspect cases. So that is a very good sign. We can use that in combination to what we're doing in the routine sample. The routine sampling gives us that added assurance that we are basically doing random testing of people who don't meet the definition. In this particular virus, because it's new, there can be various presentations that maybe we may not know of. There'll be mild symptoms. Somebody might have a sore throat that might disappear in a couple of days. So that is what we're looking to capture. So we're looking to capture something that is atypical by way of the definition. The short answer in terms of our statistical modeling and the numbers, I think we can test as many. There's no straight answer in terms of what percentage of the population that we would like to test to get that answer, but it's concurrently using both systems going together, looking at the number of persons coming into the health facilities gives us a very good idea as well. So we're using that. We're using the number of deaths that occur from various causes, as I would have noted, and I think there's a little misunderstanding in terms of the death sampling that was occurring. So we were speaking of deaths being tested, persons that would have died. Those are people that would have died in the community outside of a hospital setting. When you come into a hospital and you spend at least 24 hours, the clinician has a very good idea of what you died from or of. So someone that comes in and spends more than 24 hours, you know basically the doctors that would have seen him, possibly he died from a myocardial infarction, he died from a pulmonary ambulance, he died from a stroke. When it happens at home, there's no one overseeing that person. So what we did is there was sampling that occurred from March 7th in that community of unknowns for COVID-19, and we found of the 69 there was no positive test. It gives us a very good benchmark as to what happens with deaths. In a novel virus like this, we look at deaths, we look at hospital admission. So it's not that we're looking at the testing alone. We're looking at a number of factors throughout the spectrum of public health measures that we could give us a guide. But as of now, we are doing very well from what we can see. But to give you a number, I can't give you an actual number, but there's a lot of things that are taken into consideration, not only the testing number.
The sampling size that you would have by that would be 700 people. Yeah. What, do you think that is?
Yeah, I think there's the same question. Similar question in terms of the statistical significance of the sample size. But again, as the Prime Minister would have alluded to, we can't test people that don't come to our system. And what we have noted is there's a significant decrease in the number of people that are accessing care for even suspected COVID-19, meeting that definition, and even for viral illnesses otherwise. So we have to test what is out there, but I think the 700 will give us a very good benchmark. As you have noted, we would have sampled about 1,200 odd cases in Trinidad for COVID-19. That sampling actually began on February 7th. So between February 7th to present, we have about 1,200 samples that would have taken of highly suspect cases. So I think 700 is a very good benchmark for a short period of time, over 14 days, to tell us what is happening in the community, in addition to the other testing. We will continue to test after that. We will continue, and as we, in terms of the measures, if we are to slacken the measures after the 10th or after the 15th, as people begin to move, we will begin to see the effect of it. And once we continue doing the random sampling, if we see an increase, for instance, of number of viral illnesses occurring, we increase our sampling, we will be able to tell if there are actual COVID patients coming out, because as a result of the increased move, if there were pockets of community spread that was hidden. So we'll continue to test way after that.
Mr. Prime Minister.
Yes.
Going back, Crystal Wilson, TTT Limited. Going back to your earlier statement, pleading with landlords to exercise consideration.
Sorry,
Going back to your earlier statement, pleading with landlords to exercise consideration during this difficult period. Government had graciously said they would give a 2-month deferral period for people who had agreements with the TTMF and the HDC.
That's still in place, but the government, I wasn't speaking there to the government, I was speaking to the private sector, because a lot of the complaints that we have been getting is that even as we are grappling with this situation, there are landlords who are prepared to put people out of their residence because they have not been able to make their payment. I'm saying to those landlords, you know that many of these people live from paycheck to paycheck or from payment to payment, however they're being paid. And that position of putting people out, as a matter of fact, let me just say this to the landlords. Under the laws of Trinidad and Tobago, to evict a tenant, you're required to give notice. So those who think that you can evict people by just telling them to get out, there's a breach of the law there. But of course, you know, the people who are least able to look after themselves, the law is furthest away from them in times like this. So landlords understand that if you are contemplating eviction of anybody, non-payment of rent require some notice before you effect the eviction. And of course, if they are prepared to challenge you, it requires a court order. But the circumstances that we are under, those kinds of remedies are not what we're looking for from people who have a heart. We're saying to the landlords, the absence of the payment of the rent or the deferral of the payment, we're saying to you, landlord, in this battle against this virus, that non-payment to you or a reduced payment to you calls for an understanding from you that you too are required to share this burden. And we're expecting that you would have a heart in the sharing of this burden with those people, especially where children are involved. Evicting people on the street with children because they have not paid their rent, and you know the reason for the non-payment is not general delinquency, but because they have lost their livelihood. The government is trying to provide some assistance, and in many instances, that is not today for today. It takes a few days to get those applications in and to get funds into the hands of people. So we need the cooperation of the population.
Is prepared to extend even its deferral payment for members who have arrangements with the TTMF and the HDC?
Well, we're not talking about extending now. The period that is in place is still very valid. I mean, I hope the circumstances don't get to the point where extensions would be required, but we've given a period which is valid, and if a case can be made for an extension, surely we have to consider it, because understand, this country belongs to the people whose resources are being called upon to treat with the people's pain. If, God forbid, we get a flare-up or an outbreak, then all the bets are off. We have to respond to that in a way that wasn't the response when we started out. So what we're trying to do is not get ourselves into that situation, and hopefully what we've put in place so far should take us, if not the whole way, but a significant portion of along the way.
So on that same topic, what, if anything, can the government do to assist the victims of eviction who are given notices by the landlord?
Well, what the government has been doing, we have a Ministry of Social Development and Family Services, but as I said earlier on, the processing of assistance to these people are not today for today. We're trying to speed up the processing, but look at one example. We have a rent relief in the package of assistance. What we are discovering as we are monitoring it is that what is required is that the landlord, that I have a tenant and the tenant's rent is X, and therefore the government is going to contribute something to that or whatever it is. Landlords are refusing, many landlords are refusing to give that confirmation to the tenant so that the tenant could access the government's help. And you know why, and I know why. Understood? But we understand the plight of the tenant, but we can't just give everybody who come and say, I need some help for my rent. There has to be some kind of confirmation, some kind of qualification. And if they get that help, your landlord is refusing to confirm to the government. The next best thing is let the tenant tell you what rent he or she was paying, and you work towards that. You know what that means too. So we have these constraints on all sides, but we really need to be able to get help to those persons who need that help. And we, at the Ministry of Social Development, we are daily putting more and more things in place to bring that help in many forms. The rent relief, in the food packages, some cash in hand through a food card and so on. And we're trying to get these things to those people who are to benefit from that particular line of social support.
I was thinking more along the lines of any legal support for those who would be given letters.
Well, the legal complications eat up time and are difficult to execute on a widespread basis. So we can't really look to a legal support to deal with that whole plethora of landlords across the country who are dealing with individual tenants, right? I mean, if a tenant is having a problem, that tenant might have a right, but to have a right is one thing, but to be able to get the benefit of that right might have a process that does not cater for your hunger or your immediate pain.
Do you think that the rate of delivery of the social sector relief is far too slow, and it's not keeping pace with the rate of suffering, and it is creating a dangerous gap where people are saying, or the call to reopen the economy is gaining traction, because people are saying, I have a choice between, they're concerned about COVID, but they are also concerned, and increasingly so, about the fact that they do not have money, they can't feed themselves, they can't feed their children. So that, it's one thing to say, okay, look into.
There are two things there. One is the amount of money available to satisfy the entire need, and the other is the rate at which. To answer your question, no, we're not satisfied with the rate, because the public service as exists in managing public money is not structured for this. And therefore, it is to be expected that the public service, the standing structure, would not be able. So what we have been doing is to try to find avenues and ramp up the ability of the relevant ministry to provide that service. And you would see some increased speed in that going forward from next week. We've put additional avenues in there. For example, we are allowing people to actually get food packages from NAMDEFCO. We sent out all the families that were on the school feeding program. They have got their food cards. If you were already on the school feeding program, those people who were not on the school feeding program but are in need, the ministry has ramped up and is ramping up its ability to treat with the number of applicants, because it's an application process. And you have to screen people, otherwise the next thing you're going to hear is that we have given people access without consideration for accountability. And we end up, I could tell you this, when we had the Green Veil problem, which demanded an intervention from the government, we approved, I think the figure was $35 million, and we put the ministry to work in there. It took a little while, and the same complaints were there, but by the time it was over, it was 100 and, I don't even want to mention that. The actual amount of money that was spent, right, was about over $150 million, because we did not, you could not see up front the whole scale of it once you start dealing with individuals. We did have some defalcation as well. And also, in this case, the ministry had never catered for handling these large numbers. And with food, you need the food today. Right? With shelter, you need to pay it at the end of the fortnight or at the end of the month. So that is what puts the pressure on. And having not been geared up for this, it takes a little while to overcome the what is loosely called the bureaucratic difficulties. But I know that the ministry is making, is cognizant of it and is making strides. We are hoping that we can get a bit more involvement with the private sector. One of the things we discussed is whether those organized religious bodies that have outreach programs, whether we can just make the funds available to them and let them treat with the people who they know are in that situation, because people tend to want to go to these church bodies or church programs to get help when they're in that dire condition. So this week you may find that we will probably do some of that.
I know, for example, that some of the conditions, and you mentioned that you require the landlords to give you certain things. People are saying that they have a passport, but they may not have a valid ID. And they're told, well, you can't get, you have to get an ID card. So there are some things, there are obstacles that sometimes they are being put in the way, I guess in the desire to prevent fraud, but it is paralyzing the system to the extent that legitimate people are finding it very burdensome.
Yeah, I understand that, and we will try to eliminate or reduce or lower the hurdles to be vaulted to get help. This week, we would make some adjustments, but what we're dealing with, we have to balance it. We can't just give the money to somebody who show up. The person has to have a basis for accessing what in effect is assistance. And that's where the difficulty lies, because this is Trinidad and Tobago. We know that in many instances there are going to be people who will come, and as I said earlier on, the ones who need it most might not be at the front of the line. Right? So we have to, but because today we have set that horizon of 2 weeks, what we're going to do in this 2-week period is to make it as easy as possible in this 2-week period to get as much help as you can, even if it means lowering the burden, lowering the hurdles, and of course I would expect that the greater good would be served as against being denied the help that you can get, because we are trying to protect the public purse. So we now are going to try in this 15-day period to ramp up and speed up as much as we could and get more people involved in trying to reach those who are in need, because hopefully, at the end of that period, we should be able to move away from the restrictions that is causing the pressure that you mentioned there.
I know earlier you asked for landlords to have a heart and maybe defer rent for a while for this short period here. But from
not only defer rent, it is also accepting even a portion of the rent, which is what some people are able to pay. We've had complaints about people offering to pay a portion of their rent, and the landlord With that concern, is either you pay the full amount or you get out.
Understand the circumstances then.
Yes.
Right. But from a government and population perspective, yeah, taxes are still due. I know at least the TNT Chamber of Industry would have asked for deferral of their taxes at least. Any consideration for that, income tax?
Listen, let's put it this way. Taxes are due on profits that are already made. Let's start with that. Secondly, because of the disruption of the economy to businesses maintaining their staff and earning, the government has taken other steps to support the business community. We've made money available by the very first thing the government did from that standpoint was to take decisions so that the liquidity and the cash availability in the country is there. Liquidity jumped from 2.5 billion to 5.8 billion so that the system is there. And of course, we've gone to the step-by-step arrangements. The last thing I think the Minister of Finance spoke to was this whole question of aiming to provide access to funding to businesses to get some injection of funds to be able to maintain their business, right? And of course, those workers who have lost their jobs or got a reduced income below a certain level, if you're earning below a certain level and you got a reduced income, the government is also committed to putting some things in there. We also committed to putting some funds into the credit union to allow people who are either at jobs or temporarily out of jobs to get small loans and so on. So we've done a number of things, and we will continue to support the business community. As a matter of fact, the committee that I've just put in place, one of the things I expect to get from it is that, that we will have other support coming for the business community because we want businesses to exist, to be open, to hire people and give them job opportunities. And more importantly, funds owed by the state to the business community, the VAT returns. You would have heard and you would have seen that those payments are made. So we've done a number of things to allow the business community to try to survive the difficult period. Not all of it is in place and functioning now, but the commitment to do it is there. And what is in place ought to bring some element of relief, and there should be some confidence that all of us are sharing in this burden.
What's going on with pandemic leave?
Pandemic leave. When I first heard that term, it reminded me of a day at Maracas Bay where you're supposed to be at work and you tell your partner, I am on pandemic. You just had that. You had that sound, pandemic leave, where you're supposed to be at work, but you're really like me in Maracas. What happened with pandemic leave is that when it came out as a response and was made public as a response, the whole question of the stay home was not before us. So leave to go home has been overcome by stay home. You're home already on leave, being paid. But secondly, persons who are affected by the virus, there are some decisions to be made. Persons who are affected by the virus on confirmation from medical doctors can have their medical leave without too much trouble. And of course, the sticking point is persons who want to stay home for reasons other than medical. What kind of conditions they like to be? I understand that there are some discussions to take place there. But it has been overcome largely by the stay-home leave.
So abandoning?
No, it has not been abandoned, but it is not what it was made out to be, that anybody could get up and say, I'm home because I'm on pandemic leave. The initial arrangement as understood would have lent itself to too much abuse. You had to confine it to some kind of channel. What exactly does that mean? It means that you're authorized to be away from work and be noticed as properly being away from work. When that term first came up, it was in the context that all leave had to have some kind of designation. You have vacation leave, you have sick leave, you have whatever leave. And if you are home because of the pandemic, now, how else you can be home? If all of us staying home now till May 15th, well, you got your pandemic leave. If, on the other hand, you were a patient in the hospital and you had to be away, you got more than 14 days sick leave is available. There's a limit of sick leave that you can have. But if we are saying, if you are away because of the pandemic, you're hospitalized or you're quarantined or so, well, then all those things. So when that is, I hope that very soon it would be clear as to what it means. And but in the meantime, it's not really a problem as far as I'm concerned.
Prime Minister, I have 2 questions for you before I go back to the doctors. If I could ask both of them one time. Because the first one was asked to the Minister of Health, I think this week, about reduction in salary, and he said the cabinet, he's not supposed to speak on behalf of the cabinet. So I'm asking the Prime Minister, has that decision been taken?
What
Reduction
in salary?
For ministers, MPs?
It's always like that, eh? The largest payment of salaries in the public service is not MPs, right? We pay $4.5 billion in payments, and there is no consideration at this time to cut anybody's pay. MPs have made their personal contributions. Last month, I made 50% of my salary available in providing food for my constituents. So I'm not getting involved in this MP salary cut story. That is a matter that MPs, I know all the MPs on my side are out there sharing their resources with their constituents. But it's a nice subject to raise, and that's not a matter for the cabinet. And there's no discussion in front of the cabinet to cut anybody's salary. So I want to make that very clear, because I know that that's where that's going. We're hoping that as we look at our circumstance going forward, that would not become a requirement for the people on the government's payroll.
And my second question was regarding the supposed fallout between Minister of National Security and Barbados, if or anything was done sort of soon.
There's no fallout between the Minister of National Security and Barbados. Let's start with that. The relationship between Barbados and Trinidad and Tobago is as good as it has ever been, and Trinidad and Tobago and Barbados remain very close, brothers and sisters. If there's a difference of opinion on a matter, that is not a fallout. And of course, I know where that stoking is coming from, right? So as far as we are concerned, we have no problem with Barbados. And for those who think that there's a problem with Trinidad and Tobago, I can tell you you're mistaken. The relationship between Barbados and Trinidad and Tobago is as good as it has ever been.
No slap and counter slap.
You what?
No slap and counter slap.
In the expression of the nation.
CMO, I have a few questions for you, but one of them, I don't know if you could answer it, or Mr. Hines, because he made mention of it. He was talking about minimal or few local transmissions. Could you give us how many do you consider minimal, few, 5, 10, 15? Yeah, go ahead.
Hi, good afternoon. Thank you for the question. Out of the 115 confirmed cases that we had, there were 4 incidences in which within family clusters, there was transmission from one family member to another. And that is the extent of the local transmission that we're referring to when we say minimal local transmission. I hope that answers your question comprehensively.
So I ask as well, in relation to all of this, the apparent controversy over seeing that we are extending the stay-at-home measures, the apparent controversy between the legal position offered by the Law Association and the implementation of the operations by the police in Trinidad and Tobago police?
These are conversations that I think it is by now it should be quite clear. The Commissioner of Police said it himself. The police is not exercising any power outside of the legal construct. If the police is conducting roadblocks in Trinidad and Tobago, that's under the existing law. If it is perceived that the police is doing that to facilitate government's encouragement of people to stay home, then it follows that the police can only encourage you to stay home. And if there is any person who feels that his or her right is infringed, then the courts are still open. We are trying to encourage people to wash their hands and to not put your hand in the face. There's no law behind that. And if the legal fraternity thinks that its role in this situation is to encourage people to disregard the encouragement to stay home, then that's still a free country. If that is their contribution to the fight against the virus, let it be so. But I do not believe that the average person in this country would feel that their rights are at any risk because the government of Trinidad and Tobago is acting within the law. And you know what is galling about this? The same batch of people who in their political pole vaulting were demanding of the government that we declare a state of emergency. This government has taken the position to go the way we have gone deliberately, saying that we see no extra benefit in a state of emergency. We see benefit in encouraging the population. From this very podium, from day one, I took that position. I could easily have asked the Attorney General to take steps to have a state of emergency and we have curfew and la, 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 la. None of that would have responded to the virology or the epidemiology. None of it. But what it would have done, it would have caused your rights under the Constitution to be suspended, and it would have given the police more power. So what is this? The same thing you were calling for, more power to the police, and to abuse, and waiving of your rights under the Constitution. That was the recommendation. This government took a decision not to do that, but to do what we have done, and we stand by that, which is to educate the population and to encourage them to do that simplistic thing, which is wash your hands, don't wear a mask, don't congregate, and if you're going out the road with no real good reason to go out the road, go back home, or just don't do that. I suspect, before this is over, one of the lawyers will go to court and tell the court that the population is being asked to wear a mask. Because it's in the same vein. But we have used the laws that we had. We didn't suspend the Constitution. We've used the powers that the police had. And so far, so good. Some people are prepared to help, and some people are prepared to hurt. I will tell you this, in case you all don't know. The advice to use hydrochloroquine to this government came from doctors in this country. And it is because this government decides that we're taking no advice other than sound scientific advice. Why maybe you all have not been injected with detergent and swallowed tons of hydrochloroquine. So we get all kind of advice. But we know what advice to take. The advice that is sound, coming from a place that we've invested in. And I am so proud to be a Prime Minister of this country, to be working with a team that is working for us in this public health, because we made an investment in our population, and today it's paying big dividends. We can tell you why we are doing the things we are doing. We can defend what we are doing based on the science and the data. Those who have a problem with it, they must tell you what is the basis on which their position is different. It certainly cannot be on the science or on the collected data. Thank you very much, and see you again. One final question.
The jets coming into our airport, we've been there's been circulating what looks like a...
The use of the airport is closed to normal traffic, but if permission has been granted by the Minister of National Security through what the government has set up, if permission is granted for any entry, whether it is to bring something or to take something out or to bring a person, once the appropriate approval has been granted, the landing of an aircraft is RSS flights are coming in. Yeah. So the airport is still open, but to certain aspects of business. So I don't know what specific jet you're talking about, but there's an operation going on there still. We are still open to receive certain things and to take certain things out, but it has to be on approval. Another question. Okay, this will be the last question. Let's see.
After the 14 days random testing, how long would you all need to tabulate all the?
No, we are getting results every day, usually every evening or in the morning. So it will be a running tally, as it has been with the other system through CAFA. So we know real time what the results are. We don't need any significant length of time to tabulate any results.
And will be the same random health centers that we?
Correct. No, we're going to expand beyond the eight in Trinidad and 1 in Tobago. We're going to go beyond that.
How much beyond?
It will depend on. We will do that sampling and that analysis early on, but we will start with that group, the group of 9, and then we'll go outwards from that. Yeah, we're already using the A&Es as well. The A&Es are the accident and emergency departments. We might look at the enhanced health centers as well, which have a lot. We're looking for areas that have a lot of throughput. So a lot of people coming in with viral illnesses. Those are the targets. We're not going to select health centers that, looking at the data over the last month or two, we just have 1 or 2 cases. We're looking at the areas that would have larger numbers of cases. All right?
Are you wearing your mask to Parliament on Monday? Are you wearing your mask? What mask?
The black mask.
The black mask.
I would be wearing a mask in the Parliament. The House, I heard it's supposed to be black. I don't know what's the significance of that, but masks come in a variety of styles, colors, and fashion. But I'm expected to cooperate with what the House decides. But we will have Parliament on Monday, and I expect to be there. Hopefully, we will operate to the satisfaction of the medical personnel. And once we do that, everything's going to be all right. Thank you.